So still on folic acid. Now, this category of women, listen to me. If you have ever delivered a baby with neural tube defect, what I mean is swellings at the back, or a baby with cleft palate, or a child with imperforate anus, or if you have ever had a case in your family, first degree relative, sisters, or maybe brothers, or parents that has delivered a child with any of these deformities I mentioned, the neural tube defect, or cleft palate, or imperforate anus, or you are diabetic and you're pregnant, this video is for you. Let me add also, if you are on any medication we call anti-folate medications, like proguanil, like medications containing trimethoprim. In full, it's actually trimethoprim sulfamethoxazole. That's what we call Septrin. Or any medication that is an anti-folate medication, methotrexate, one we use for some malignancies. Now, if you're on any anti-folate medications, the one I mentioned, the commonest like Septrin, like I said, or Dapsone, they use in treating leprosy, is an anti-folate medication too, or proguanil that most people that have sickle cell take. Those things, they have anti-folate activities. You need not to play with your folic acid. In fact, even before you get pregnant, please, this category of people I called, you need not to joke with your folic acid, because you are already on medications that are anti-folate. That is, anti means that are against folate already. So you need a higher dose at least to compensate for the ones that your medications will chop off. Then those category of women I talked about, you've delivered a child with a congenital malformation before, or neural tube defect before, or imperforate anus before, or in your family line, family history, sisters, siblings, close first degree relatives, you've had people or women that have delivered that kind of child with such defect, you also need not to play with your folic acid, because it shows that it's either in your gene there is some form of something that actually makes your folate not sufficient, which means you need to have a lot of it. And this folic acid, the importance cannot be overemphasized. So please, I'm trying to give you the category of women or people who should not play with their folic acid. I did not say the others who have never doesn't have this should play with it. No, folic acid is for everybody. But this category of women I just called now, with either those taking the antifolate or those in those category of previous history of malformations in children, please don't joke with your folic. In fact, the books will say take higher doses. Well, even the 5 milligrams we give to women every time is still like a high dose, it's still okay, but they should not play with it every day. Even before they get pregnant, you should be on your folic acid, so that you will not put the next child, that, for instance, those who have had a child with neural tube defect or cleft palate or one deformity or another, in your next pregnancy, you should be regular on your folic acid. In fact, even before you get pregnant, so that you not put the other child or the coming child at risk of having any of these deformities like we mentioned, or if you're diabetic, or if you're on anti-folate medications. I hope this video is helpful. I hope you have learned something. So share it to those your aunties, those your sisters that you think will need it. And I'm sure almost all your female relatives will need to see this video and learn from it. Next video, I'll talk about more on antenatal, especially the first trimester. But remember, if you have any form of malignancy, what we call cancer, please see your doctor. They will know how to direct you on what to take. We don't usually give folic acid directly to them. But then, like I said, you see your doctor and discuss that. See you next time with more information. Like I said, I'm here for you always. Bye.